Good morning, everyone. My name is Derek Miller, and I'm the Chief Operating Officer with the Saskatchewan Health Authority. Welcome, and thanks you so much for joining us today. I'm honored to be here to share the SHA's operational plan for the opening of the new Regina Urgent Care Centre. First, I want to recognize that we're gathered here today on Treaty 4 territory and homeland of the Dakota, Lakota, and Métis. Recognizing this history is important to our future and our efforts to close the gap in health outcomes between Indigenous and non-Indigenous peoples by knowing what the land and the traditional people of the land offer us. Earlier today, the Saskatchewan Health Authority announced that Saskatchewan's first urgent care centre will be opening its doors to patients in Regina on Tuesday, July 2nd, starting a new era of urgent care delivery in the province. During our first phase of operations, teams will open the doors to care for patients 7 days a week from 8 a.m. to 9:30 p.m. During this initial phase, care teams will ensure those seeking care towards the end of the scheduled hours will have time for treatment and tests to meet their patient needs. The second phase of operations will occur over the fall of 2024 and will see the Regina Urgent Care Centre accepting patients 24 hours a day, 7 days a week. This phased approach to commencing operations will allow the SHA and our teams here at Regina Urgent Care Centre time over the first phase to implement this first of its kind team-based model of care. During this first phase of operations, we'll be adapting and improving our processes and procedures as we prepare to open 24 hours a day, 7 days a week, during what is typically a higher demand time in the fall. This new model of care will see physicians, nurse practitioners, registered nurses, technicians, and other allied health professionals work together as one team to provide exceptional, urgent patient care in the community. As a first-of-its-kind health facility in the province, the Regina Urgent Care Centre model is designed to provide another option for patients who need urgent care who may not be able to access their primary care provider after hours or on short notice, and avoiding emergency department visits for care that can be safely delivered in another setting. Dedicated mental health and addiction services within the Urgent Care Centre are anticipated to be a game changer for our teams and our patients. Our teams will be able to care for patients discreetly and confidentially, supporting their immediate needs through assessment, counseling, prescriptions, connections to resources, and referrals, providing an improved experience. Providing the right care at the right time is central to our model of care here at Regina Urgent Care Centre. Each patient arriving will be assessed, and those with the most urgent care needs will be seen first. Based on initial projections and historical emergency room data, the Urgent Care Centre's model of care is anticipated to help divert at least 20,000 yearly patient visits away from Regina's emergency departments. I would like to recognize our important partners with the Government of Saskatchewan and the Hospitals of Regina Foundation that have made this innovative facility a possibility. We are thankful that the province has committed significant funding to support the construction and operations of the Regina Urgent Care Centre. And the Hospitals of Regina Foundation, through the philanthropic support of their generous donors, has provided $2.4 million for the procurement and installation of technology, equipment, furniture, and fixtures for the facility. Their collective support and investment is making the opening of this facility a reality. The upcoming opening of the Regina Urgent Care Centre represents a major step in supporting the SHA's ongoing efforts to address capacity pressures in Saskatchewan's urban centres. With that, I also want to share an update with you about the Regina and Saskatoon capacity pressure action plans and how this new model of care impacts our system capacity. Since the introduction of the action plans in late 2023, significant progress has been made to reduce capacity pressures, enhancing the patient care provided by the SHA teams and staff. Through these action plans, we've hired more than 290 new staff in Regina and Saskatoon, including almost 100 new nursing positions. These new positions within our acute care facilities and community settings focus on easing capacity pressures and enhancing patient flow to the appropriate care environment. In Regina alone, we've hired 58 new staff positions, including 21 new nursing positions, which have positively contributed to reducing Regina capacity pressures. I am pleased to say that there has been a 21% decrease in the monthly average of patients waiting in Regina hospitals for care in a community setting compared to before the launch of the action plans. This means there's more room in our acute facilities for emergency patients that are waiting for admission. We've also seen a 50% decrease in the monthly average of admitted patients waiting in emergency rooms for an acute bed in Regina. Additionally, 20 new transitional care beds at Regina Lutheran Home are now available to accommodate patient transitions from the hospital to community settings. Specific to Saskatoon, we've hired 232 new staff positions, including 83 new nursing positions, which has positively contributed to reducing Saskatoon capacity pressures. Saskatoon has also seen a 46% decrease in the monthly average of patients waiting in hospital for care in a community setting, and a 44% decrease in the monthly average of admitted patients waiting in Saskatoon emergency rooms for an acute care bed. Additional capacity has also been provided for patient care transitions from hospital settings in Saskatoon through 84 new long-term care beds that are becoming operational through the month of June. These new beds are in addition to the 75 convalescent and transition care beds that were added through the Capacity Action Plan earlier this year. I want to express my deep appreciation to our healthcare teams across the province, particularly in Regina and Saskatoon, who have contributed to the ideas and the implementation of those ideas in addressing capacity pressures in our major urban centers. We are making progress, and while there is more to do, we are seeing patients increasingly receiving the right care in the right care setting. Regina's Urgent Care Centre is the first of 2 urgent care centres in Saskatchewan aimed at enhancing capacity in the community, in part to reduce the strain on our emergency departments and hospitals. The SHA is eager to see the same urgent care centre model arrive in Saskatoon. I'd like to thank our healthcare teams who are working to bring both of these projects to reality, and to the staff and physicians who have already joined the Regina Urgent Care Centre team as we embark on this historic new chapter in Saskatchewan's healthcare journey. Thank you so much for joining us here today, and I look forward to seeing you all back for the official grand opening. With that, we'll now open up for questions from the media. Yeah, we have actually in Regina established 20 transition care beds at Regina Lutheran Home with the same intent that we would be able to transition patients that are currently in the hospital that don't need hospital level care, but still need some level of care before they can transition home or to a personal care home. And those are now operational just in the last few weeks. So we're opening on the 2nd of July with a phased opening. So we'll be opening at 8 a.m. and closing at 9:30 p.m. With the ability after 9:30 p.m. to be able to continue to care for and treat patients before they're released home or transitioned elsewhere. We will be working towards a full 24/7 operation starting in the fall. We had experienced through the course of last fall a lot of pressure in our emergency departments. And part of it was due to patients that were in our hospitals that could be cared for better in the community. And so our action plan has focused on relieving those pressures, ultimately in order to ensure that we're able to meet the care needs of patients in emergency departments and avoid situations where we're over capacity in emergency departments. So we're estimating potential to divert about 20,000 patients a year from emergency departments. That's about 55 patients a day. And so that's our start point, and that's what we've been planning on. Although we do know that this is a first in Saskatchewan model, first in Regina, and so we know we need to be flexible, and we'll be watching and monitoring what kind of patients are presenting, what are their care needs, in order to make any adjustments that we might need to in terms of volumes and type of services required. Right now, we've recruited 116 staff to work in the urgent care center, and we're working up to 125. And we've also recruited physicians in order to be able to fully operate during this in the phased opening for the initial hours, and then obviously we'll be working up to the 24/7 operation in the fall. Thank you all so much for joining us today. We're really excited to launch this new facility, and also looking forward to the grand opening, which will be coming very quickly. So thank you all, and enjoy your day.